Hello, I'm Dr. Jenny Andrus, and welcome to Joint Ventures. In this OSC original podcast, we aim to answer those questions we get from patients every day in a detailed way that we might not have time for in the office. And today's question might get asked 20 times a day. Can a diabetic have a steroid shot? Well, let's look at the facts. Arthritis is an extremely common condition, and unfortunately, type 2 diabetes has become increasingly common as well. Steroid injections are staples in the management of arthritis pain. Steroids can also raise blood sugar, though. So what happens if you're a diabetic? Does this mean you can't have a steroid injection? Ben Franklin said the only guarantees in life are death and taxes. Well, I would add that if you reach a mature age, you can add the guarantee of arthritis. Now, wear and tear of the joints isn't always painful, but for many, chronic joint pain from arthritis is a daily reality. Doctors have been treating this with steroid injections forever. Whether it be for the joints or for the spine, steroids can provide a lot of relief and allow for more normal movement of the joint. By allowing for this more normal movement, a person can then strengthen the structures around the joint. So the injection can be used to reduce pain, but also to facilitate rehab and functional recovery. Now, diabetes is unfortunately on the rise in America. Tied highly to obesity, about 10% of adults are diabetic. Older age and obesity are risk factors, not only for diabetes, but also for arthritis. So these conditions are often occurring concomitantly. Corticosteroids, which are injected for arthritis pain, act by binding to glucocorticoid receptors, which are present in virtually all human tissues and control carbohydrate metabolism. So potentially treating one problem could worsen the other. What do we do? Well, first, let's consider how significantly do injected steroids actually increase blood sugar. Well, one study looked at 72 patients that found blood sugar increases in diabetic patients after steroid injections most frequently occurred within the first 1 to 3 days. Another study found that elevations in blood sugar were limited to 3 days. This study found that patients with even moderately well-controlled diabetes could still see significant increases, and that meant like a glucose of greater than 350. That's pretty high. Several studies on epidural steroid injections have shown that blood sugar may be increased up to 4 days after injection. None of these studies showed complications like diabetic ketoacidosis that would require hospitalization. We know that transient blood sugar elevations are likely to occur in diabetic patients, even if their diabetes is well controlled after a steroid injection. Despite the temporary increase, the risk of a person developing severely elevated blood sugar and complications are unlikely, although, they could happen. So for most patients with diabetes, steroid injections can be done safely, even if they don't have optimal blood sugar control. But we just reviewed that for a few days after injection, blood glucose can be significantly increased. So what do we do to reduce a patient's risk of a serious blood sugar spike? Hyperglycemia is likely related to the dose of steroid, so using the lowest dose necessary is prudent. Now, if you go back to a previous podcast that we did on steroid injections, we discussed a recent consensus statement that showed that the dose of steroid could be reduced or removed for some injections with the same good results. It is really important to tell your doctor if you're taking oral steroids, have taken them recently, or have had other steroid injections. Let me give you an example that I run across pretty much every day. A patient has an increase in pain and goes to urgent care or primary care and is given a course of oral steroids. They make an appointment with me, and I see them while they are still on the oral steroids. Their blood sugar might be elevated from the oral steroids, and then an injection that I would give them would potentially raise it more. Another example I see a lot is when a patient is seeing different doctors, often in different medical practices for their joint problems. Say a patient sees me for their spine and is seeing an orthopedist for their knee and their shoulder. If that patient had a recent knee and shoulder shot, their blood sugar could still be elevated, and that might become worse if I then gave them a third injection for the spine pain. No universal accepted pre-procedural glucose cutoff exists. The ADA, the American Diabetes Association, recommends that in a patient with a blood sugar of over 180 or hemoglobin A1C of greater than 8, that you consider them of higher risk. Most experts I know use a cutoff of about 200 for steroid injections, meaning that if a patient has been having glucose readings over 200, they would recommend postponing steroid injections, and that's what I typically use in my practice as well. Another consideration is active infection. Being sick can impact your glucose control. So when a patient has an infection, even just, a cold, they can have trouble keeping their blood sugar down. In those situations, it would be best to postpone a steroid injection as well. Patients need to monitor their blood glucose frequently for the first 3 days or until their levels start to return to baseline. If a patient notes a significant increase from their baseline, they should contact the provider who manages their diabetes and discuss medication changes. If a patient's on insulin, they may already have a sliding scale that they can use to address the blood sugar spikes. Excessive thirst, hunger, fatigue, an urge to urinate large amounts, that's all signs of high blood sugar. If there are serious symptoms like confusion, weakness, difficult or fast breathing, blurred vision, rapid heart rate, abdominal pain, nausea, vomiting, all more severe symptoms, that could represent a serious complication and that patient needs to go to the emergency room. Typically, if blood sugar is over 300 and not responding to treatment, then a patient should seek medical help, even if they aren't having symptoms. What about other effects of steroids? In the cardiovascular system, they can cause fluid retention, hypertension, aggravation of arrhythmias. In the nervous system, they can cause mood changes, insomnia, vasomotor flushing, headache, vertigo. Immunological effects include reduced resistance to infection, delayed healing. Heartburn, like reflux, and menstrual irregularities are also possible, but this is not particularly likely, any of this, with the dosage that are given for joint injections. So talk with your doctor about your diabetes. Let he or she know your blood sugar, how it's been doing before you have any injections. If you've recently taken oral steroids or you've had other steroid injections, just let us know. If your blood sugar hasn't been well controlled, your doctor can decide what's the best next step for you. These injections, guys, are elective. If need be, we can postpone to a better time. Keep a close eye on your blood sugar for 3 days after the injection. If the values remain elevated, talk to the provider who treats your diabetes. Thanks so much for listening. I hope you guys learned something today. Please rate us and subscribe. Wishing you good health and see you soon. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.